Hello everyone. Today we're going to continue the Peter K. Thomas technique of waxing. So before we go any further, I just want to review some of the books that are on the market. The one we're using is Tooth-to-Tooth Occlusion by Thornley and Hunt. I found it to be the simplest of all the books out there. So you're familiar with this one so far. Hopefully you've read through all the books. Let me show you some of the other ones that are on the market just as good. Introduction to Occlusal Anatomy. If you notice, the design is the same. So the pages change vertically. It goes through all the various procedures. I find it to be in black and white, so a little more difficult to understand, but it's the same concept. So Introduction to Occlusal Anatomy. Another book, which is one of the classics that everyone in the field knows, is Occlusal Morphology by Dr. Frank Salenza. He was one of the pioneers of gnathological waxing. And this year you'll be attending a meeting, the Northeastern Gnathological Society. He was one of the founding fathers. In fact, he was one of the earlier presidents, and his son was also the president, and a name that just everyone knows in the profession. A very dedicated person, spent his entire life developing gnathological concepts. Nick Schillenberg, Guide to Occlusal Waxing, also an excellent book. We've used it in the past. I found it's a little more difficult for students to use, so I stopped using it, but I have all these books if you'd like to borrow any of them, or they'll be in lab. Maybe if you use a little bit from each book, you'll understand it a little better. Last, Lang, Wax Up a Functional Occlusion. Again, these are all lab manuals. They have various techniques and explanations on how gnathological concepts work. So I'll have all these books in class, and we can refer to them back and forth, but we'll stay with our tooth-to-tooth occlusion. Okay, before we keep going, just want to review how to move an articulator. I find some of you are not quite sure how to work this instrument, and as you know, this is a $900 semi-adjustable Stratus articulator. Stratus, this one's a Stratus 300 model. But you're using it like it's a $5 articulator instead of a $900 articulator. So we've already set, previous videos, we've already set up the occlusal scheme. We put in the measurements that the doctors gave us, 30 degrees on incisal guidance angle, 15 degrees on lateral condylar movement. So now, how do we move this? There are locking mechanisms, so when you're not using it, make sure these things are locked in place so nothing slips out. Each day before you start, make sure you tighten up each one of these knobs to make sure nothing's moved. Now if you want to move the articulator, unlock it. If I want to move in a lateral movement, hold it with two hands from the back, put your thumb on the condylar area, and if I want to move off in one direction, take one thumb, push with one thumb, and you can see that the articulator, and if you look at the teeth, moving into a balancing movement. But on the other side, of course, it's a working movement. If I want to go in the opposite direction, the other way, one thumb, push with one, and you can see the articulator moving in a lateral movement. If I want to protrude, hold it with two hands, two thumbs, put two thumbs on the condylar element at the same time, push straight back, and if you look at the centrals, you can see now the incisors are sliding over each other, and the posterior teeth, the occlusion is opening up, so it's mutually protected occlusion. So on every time we add wax, we're going to the right, we're going to the left, we're going for protruding and retracting, and eccentric occlusion. Okay, so let's keep going. So at the end of the other video, what I did in the demonstration, we established the line angles, and we did the line angles in blue wax. All the doctors have commented over the years, the one area that our graduates seem to have problems with is line angles, especially on anterior teeth. It's not an easy thing to do. So line angles and point angles, we'll spend some extra time to make sure we do this correctly. So again, to go back a little bit, we did the buccal contour, lingual contour in red wax. Then we did the line angles in blue wax, and if you look down at it, you can see that you have a V shape. So you have a V shape embrasure. Let's take this model. Maybe this is easier to see. If you look down at the master model, you can see a V-shaped buccal embrasure, a V-shaped lingual embrasure, a V-shaped occlusal embrasure, and a V-shaped cervical embrasure. So these are the areas we have to focus on. So now we've already done all 4 corners. So now we're ready to move on to the marginal ridges. The marginal ridges, we'll do them in green wax. So if we look at the textbook, remember, think of what you're doing. Think of the end product before you even start. Don't just start dropping wax because it's never going to work out. So now we've already done the buccal contour, we've done the lingual, we've done all 4 line and point angles. Now it's time to go on to the marginal ridges. If you notice in the book, and again, another reason to use the book because you're memorizing these one part at a time, we have contact on the distal marginal ridge, nothing on the mesial. So now, distal, 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 distal. There's 2 more premolars, distal. So it's distal, 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 distal. You just learned 6 contacts. So it's not as hard as you think when you look at all these dozens of different contacts. So on the mandibular teeth, it's distal marginal ridges. But on the next project, it's going to be maxillary wax up, and it's going to be mesial marginal ridge. So here it's distal, 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 distal on the lower, and on the upper, it's going to be mesial, 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 mesial. But we'll get to that probably in the next couple of weeks. So let's start establishing, and if you look at this, if you have no contact here, you have no way to know how to establish it. It's either going to be too big or too small. So we're doing all the distal ones first. Once we do the distal, and let me go back to the model. Once we establish the distal marginal ridge, then we match up the mesial, and the 2 are the same height. So we'll do distal, 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 distal. Once that's established and we have a contact point, then we'll duplicate it with the one next to it, make a slight occlusal embrasure, and it's done. So we have a V shape here on the facial side, we have a V shape on the lingual side. Essentially, all we're doing is connecting the 2. So let's go. It's a relatively easy procedure. I'll start with the premolar. Let's use this one instead. I'm going all the way to the bottom, and I am on the distal marginal ridge of the first premolar. It's a straight line. I noticed from the textbook, let's leave the book here, so this is the area I'm establishing, the distal marginal ridge. When I think I'm there, close it down, centric, working, balancing, protrusion, retraction. If I open it up and look at it, I can now see that I have very subtle contact, so I have the distal marginal ridge. Once I have the distal marginal ridge, I can go on to the next. Go to the second premolar. Start all the way in the bottom. Marginal ridge is just a linear elevation on the distal portion of the tooth. Close it down. I can see the contact, centric occlusion, working, balancing, protrusion, retraction. The next one is done. Now come to the molar. Start all the way in the bottom, don't leave any voids. Eventually, once you get very good at this, you can start combining steps. And of course, in a laboratory, they'll be using 1 color wax. We're only using all these different colors just for learning purposes. Here's my distal marginal ridge on the molar. Close it down. There's my contact. Centric occlusion, working, balancing, protrusion, and retraction. Let's come over and see how it looks. If you have any excess, clean it off now. So now I've established the distal marginal ridge on all 3 teeth. Now I can come right next to it and I can do the mesial marginal ridge. Come to the adjacent tooth. Doing this by eye. Remember, when you look at the textbook, there is no contact on the mesial side, so you have to match them up. That's why you're doing the distals first. Don't try to do it all at one time. It's just going to be a mess. Take the few seconds that it takes and do it correctly. So I'm establishing the mesial marginal ridge on all 3 teeth. to match the distal that I've already established. So now I have all the marginal ridges in place. I can take whatever instrument I have, whether it be an ash trimmer or whether it be an X-Acto knife, or whatever instrument I feel comfortable with or you own. I can make a very, very slight occlusal embrasure. Once the occlusal embrasures are done, that area is finished. Now the last step for this video, we're going to establish the triangular fossas. If you think about this, we've now finished the buccal side, we finished the lingual side, we finished the mesial and distal marginal ridges, we have all the point angles. They refer to this as a fish mouth. So you can see we've done the outer occlusion. Now we're coming into the center, so ultimately the next video will have all the triangular ridges, transverse ridges, to finish off the occlusal scheme. But before we do that, we know there's a fossa on each side, a triangular fossa, mesial triangular and distal triangular fossa. If I start adding all of these ridges, let's see if I can find a different picture. If I start adding all of these structures now, what's going to happen, by the time I'm finished, I'm going to have a hole right here and a hole. When you try to fill in the hole, you'll wind up messing up all of these other structures, which are probably the most difficult part of the occlusion. So right now, seeing that we were just using green wax, we're going to take a little bit of green wax and we're just going to make a triangular fossa. It'll probably take a drop or so. So on each side, we're just creating just a slight depression. There's no contact at all in the fossa. Even though we call it cusp to fossa occlusion, you're now realizing it actually does not go into the fossa. The contact is in other spots. You can see it on the buccal tip, you see nothing on the lingual, you see contacts on the inner part of the triangular ridges, the distal marginal ridges, you can see contacts all over. But even though we call it cusp to fossa, it's actually not cusp to fossa, it's more cusp to marginal ridge, if anything. But we can talk about that in the lecture class when we have more time. So what I'm doing right now, I'll just build up probably no more than a drop or so. And I was working with green wax, so I might as well stay with it. And all I'm going to do is in the area where the fossa is, I'm just adding just a speck of green wax so I don't have to go back to it later and try to fill in any void. So again, this is only taking a drop or so. It's just establishing the depression, which is a triangular shape. You already know that from first semester. So at this point, the fossas are done. This is probably the easiest step. In the next video, we'll be establishing each of the triangular ridges. So let's mark it in red. If you notice, the mesial buccal points to the center. The mesial lingual curves into the center. The buccal comes into the center. The distal lingual points into the center. You can see how they all meet at the central fossa. And that small distal cusp will be the last one we do out in the corner. So we're going to be establishing all of these one at a time in the next video. But before we finish, let's look at it. Make sure we understand what we're doing. We'll be going over these one at a time. And you can see the contacts tend to be down in the center of the occlusion, not up on the tip where you always thought they were. On the lingual side, if you notice, some curve to the right, some curve to the left, some point straight in. So we're going to establish each of these one at a time. And if you notice, they're not even in the center of the triangular ridge. It's actually slightly off to the distal. This one's slightly to the distal. This one's in the center. This one comes in and makes a sharp turn. This one comes in, there's two contacts, makes a sharp turn. So they all essentially meet here. So if you remember the definition of class 1 occlusion, let's take the model. On class 1 occlusion, the mesiolingual cusp of the maxillary first molar occludes with the central fossa of the lower first molar. So this large mesiolingual cusp actually comes down and hits all these areas at the same time. So that'll be the next video. So let's stop for now. Let's go ahead and do the finish the marginal ridges. Make sure you do the distal marginal ridges first, green wax. Once you have the contacts, then match them up with the mesial. Then take a carving instrument, make a slight embrasure on all of them. You do not want to go back and fix up anything. Once you finish one step, that step is done. You're not going back to it for any reason. So make sure everything is perfect. Make sure the embrasures are open. Keep everything nice and clean. And that's it for now. See you next time.